If your child has ever had a urinary tract infection, you know how awful it can be. The pain, the tears, the stress of waiting for antibiotics to work. And for some families, it doesn't stop at one infection. UTIs can keep coming back. And that's when parents start asking me, why is this happening and what can we do? Today, I want to walk you through why recurrent UTIs are so common in children, why antibiotics alone don't always solve the problem, and what the research says around probiotics as a supportive strategy. Hi, I'm Emma Sutherland, clinical naturopath, author, mum, and your host. With over 20 years in clinical practice, I've supported many children with recurrent UTIs. And I know how distressing this can be for both parents and kids. My goal today is to translate the research, explain what probiotics can and can't do, and help you feel informed and empowered when discussing options with your child's GP. So recurrent UTIs are far more common than many parents realize. Research shows that up to 30% of children experience a UTI after their first febrile infection. Risk is higher in children with bladder dysfunction, reflux, bowel issues, or immature immune systems. The conventional approach often involves repeated antibiotic courses or long-term low-dose antibiotics as prophylaxis. And while antibiotics are essential for treating acute UTIs, they're absolutely life-saving when they're needed. But repeated exposure raised very valid concerns of disruption of the gut and the urinary microbiome, of increased antibiotic resistance, and potential long-term effects of immune system. Now, this has led researchers to ask an important question. Can we support the body's natural defenses alongside antibiotics, especially for prevention? For a long time, we believed the urinary tract was sterile. We now know that that just isn't true. The bladder and urinary tract have their own microbiome, which plays a key role in preventing harmful bacteria from taking hold. Also for supporting mucosal immunity, reducing inflammation, and the risk of UTI reoccurrence. Repeated antibiotic use, particularly in early life, can disrupt this ecosystem, making infections more likely to reoccur. This is where strain-specific probiotics have come into the conversation, not as a replacement for antibiotics, but as a way to support the mucosal defenses, reduce pathogen adherence, and modulate that immune response. Let's look at study number 1, which was a recent placebo-controlled clinical trial that looked at 54 children aged between 3 and 18 years of age with a history of recurrent UTIs or kidney infections plus underlying risk factors. They were given a specific probiotic combination, Lactobacillus rhamnosus PL1 and Lactobacillus plantarum PM1 for 90 days, and they were followed by 6 months of observation. Here's what the researchers found. 26% of children in the probiotic group experienced another UTI compared to 44% in the placebo group, almost a 50% relative reduction in UTIs. Children taking probiotics also required fewer days of antibiotics. The probiotic was well tolerated with no side effects reported. Now, the study didn't reach statistical significance, likely because the sample size was small. But the direction of benefit consistently favoured the probiotic group. What's important is that this isn't the only study. Let's look at study number 2. It's a peer-reviewed clinical trial which looked at 181 children between the age of 4 months to 5 years after their first febrile UTI. A febrile UTI is a UTI that involves a fever which can indicate that the bacterial infection has moved to the kidney. In this study, children who took probiotics had a significantly lower risk of developing another UTI compared to the children given the placebo. This was seen in children with otherwise normal urinary tracts. This study suggests probiotics may be helpful for both early, but especially after a first UTI, in children that are already experiencing UTIs. Now, I treat many kids in my clinical practice, and I feel it's always important for parents to have very clear guidelines. The first is that acute UTIs always need medical care. Probiotics do not replace antibiotics during an active infection. If your child has pain, burning, fever, urinary urgency or accidents, behavioral changes, they need very prompt medical assessment. Do not delay. The second is that if UTIs keep reoccurring, prevention matters. This includes supporting the microbiome, improving bladder and bowel function, reducing inflammation and irritation, and probiotics should form part of this plan. My third piece of advice is to choose probiotics based on evidence, not marketing. Not all probiotics help UTIs. The research supports specific strains, not generic products. This is where professional guidance really matters. My last tip comes from treating thousands of children over the last 23 years. Constipation and incomplete bladder emptying are major risk factors for UTI in kids. Make sure your little one has adequate hydration, regular toilet breaks, and a fiber-rich diet to support bowel motions. I remember I had one little patient who was pooing daily, but when I looked at her abdominal x-ray, she had a lot of fecal loading in her bowel. She wasn't completely emptying her bowels, and that was causing her recurrent UTIs. As soon as we did some work on her gut, the UTIs stopped. And remember that antibiotics are sometimes unavoidable, but supporting the microbiome alongside the antibiotics can help reduce the risk of reoccurrence. So recurrent UTIs are very distressing, but parents, you are not powerless. The research tells us the urinary microbiome matters. Probiotics can reduce recurrence and antibiotic exposure. And integrative strategies deserve a place alongside conventional care. This is not about choosing sides. It's about choosing what works best for the child in front of us. Thank you so much for being with me today. Don't forget to like this video, hit that subscribe button, check out the links in the show notes for more health empowering information.